Passive movement. Topics: passive movements, type of passive movements, mobilization, accessory movements, manipulation, sustained stretching. Passive movements.
These movements are produced by an external force during muscular inactivity or when muscular activity is voluntarily reduced as much as possible to permit movement.
Classification. The passive exercises are classified as following: relaxed passive movements including accessory movements, passive manual mobilization technique, mobilizations of joints, manipulations of joints, controlled sustained stretching of tight muscle. 1. Relaxed passive movements. These are the accurately and smoothly performed by the physiotherapist. A knowledge of anatomy of joints is required. The joint is moved across the existing free range and within the limits of pain. Accessory movements. They occur a part of any normal joint movement, but they may be limited or absent in abnormal joint conditions. They consist of gliding movements, rotational movements. These cannot be performed in isolation as a voluntary movement but can be isolated by the physiotherapist. 2. Passive manual mobilization. A mobilization of the joint. These are usually small, repetitive, rhythmical, oscillatory, localized, accessory, or functional movements performed by the physiotherapist in various amplitude within the available range and under the patient's control. B. Manipulation of the joints. Physiotherapist. These are accurately localized, single, quick decisive movements of small amplitude and high velocity completed before the patient can stop it. Surgeon-physician. The movement are performed under anesthesia by a surgeon or physician to gain further range. The increase in movement must be maintained by the physiotherapist. C. Controlled sustained stretching. Passive stretching of the muscle and other soft tissue can be given to increase range of movement. Movement can be gained by stretching adhesion in these structures or by lengthening of muscle due to inhibition of the tendon protective reflex. Principle of relaxed passive movements. Following are the principles of movement. 1. Relaxation. 2. Fixation. 3. Support. 4. Traction. 5. Range. 6. Speed and duration. 1. Relaxation. Suitable starting position ensure comfort and support, and the bearing of the physiotherapist will do to inspire the patient's confidence and cooperation. 2. Fixation. It is used to localize movement to the joint, so proximal part of bone is fixed. 3. Support. Full and comfortable support is given to the part to be moved, so the patient has confidence and will remain relaxed. The physiotherapist's stance must be firm and comfortable.
4. Traction. It is thought to facilitate the movement by reducing inner articular friction, fixation to the proximal bone and an opposing force through a sustained pull on the distal bone.
5. Range. The range of movement is full as the condition of joint permit without eliciting pain or spasm of the surrounding muscle. In normal joint, slight overpressure can be given to ensure full range.
6. Speed.